Hi, I'm Patty Plaskin. I'm an oncology social worker at Shore Regional Cancer Center, and today I'm going to talk to you about stress and hopefully how to avoid stress. We all probably know what stress is. It's a physical reaction that we have in our bodies. It involves adrenaline and cortisol and neurochemicals, and it's a very primitive response. We all have heard of the fight or flight reaction to a threat. So that's something that's very primitive, but we still have an appraisal opportunity with our mind to look at the event and decide how much of a threat it is, and therefore how much of a stress response we're going to have. If you think about when you're driving in your car and you hear somebody screeching behind you, you look in that mirror to see if it's somebody screeching behind you, so you can figure out if you need to put on the brake or pull over. You do have a split second in there usually to make some kind of appraisal. You wouldn't just slam on your brakes and not be aware of all your surroundings. So as we get older, we have the executive function ability to assess and appraise stressors. But when we don't do that, and they kind of take control of our bodies, that's when we can have stress that leads to inflammation and pain and stiffness and tiredness and fatigue and disruption of our digestive system and cortisol overload that winds up being weight gain, high blood pressure, diabetes, and of course irritability, mood changes, brain fog, and depression, mood swings. Not pleasant for us and not pleasant for the people who have to live with us. So today my presentation is going to be about 5 things that are beliefs that we all have been kind of conditioned to believe that I'm going to challenge, and I'm going to give you some hacks for how to rethink these things. So the first thought is, someday I'll have it all done. Boy, if that doesn't set us up for sabotage, because you can do anything, but you can't really do everything. But we think we could and should. We have these really long lists that we just keep piling more on. In fact, it's almost like you get giddy because your list gets so long and you want to see how much you've really marked off of it. But don't you also feel a crash at the end when you realize that you didn't get half the things done that you wanted to, or you added more stuff on the list, or the things that you got done on the list weren't really the most important things, and then you feel bad. So having it all done really isn't something that we should do. We probably have self-imposed these deadlines. Probably if you knew someone and they had a big long list and they didn't get everything done, if they didn't get everything done, you would be very patient with them and you would be forgiving, but we don't forgive ourselves. We're very hard on ourselves. So think about being as kind to yourself as you would be to somebody else. The next thing that we believe in is that we should all be multitasking to get everything done on that list. But the multitasking is not a natural or productive phenomena, really. It's a myth that you can get more done in less time, or that you are just as effective or maybe even very efficient by doing multiple tasks. If you think about a computer, if you open up too many windows and you're trying to use too many programs, it slows down or it'll crash. And the same things happen when we use our cognitive skills. Of course, physical things, you can walk and you can chew gum. Cognitive things are very different. And if you think about when you're watching TV and somebody comes in the room and they're trying to ask you something, at the same time you're trying to watch this sporting event or hear the punchline to a joke, it's very hard to listen to both people. And we often fail at doing either one of them well. So that is what the research shows. When we multitask, we're really not being efficient. We're actually slowing our cognitive abilities down. And really, faster is not better. There's faster driving, more drinking, spoiling children. More is not necessarily better. But we have to deal with that myth. And the other problem with saying that you should multitask is you feel bad when you don't finish something, because you have so many of those windows open on your computer that you never get the satisfaction of feeling calm that you have completed something. Instead, you feel bad or you feel adrenaline to keep working on it, and you're creating this cycle of more stress. So the hack for that is mindfulness. It is to think about what you're doing while you're doing it. And that can be really hard for people who are constantly multitasking. So a good example of this is to find one thing that you do that you only do as a singular task. So sometimes for people that's brushing your teeth. You're not putting on your shoes or setting your watch while you have your toothbrush in your mouth. You know, you're trying to just focus on that. And then give yourself credit for doing a singular task. And the more you do that, the more it will become comfortable for you. Then you'll also start to feel the satisfaction of getting something done, a singular thing done well, rather than many things left undone. Another problem is we have a belief that our stress is going to kill us, which makes us more stressed. We've heard a lot of things in the news about the relationship between stress and heart attacks. People go to work on Monday mornings and they're all stressed out about going to work and they're more likely to have a heart attack. Cancer patients are afraid that if they have too much stress, they're going to wear down their immune system. But that's not shown to really be true in the research. What happens is it's how we perceive our stress. So if little things make you very stressed, yes, it could affect your immune response. But there are people who have very big things that happen to them, and they're able to cope with them or put their life into perspective, and they move on. And that's why some people who have PTSD can actually become resilient. So we don't have to be afraid of stress. We can manage it. Another belief we have about stress, particularly for cancer patients, is that there's nothing they can do, whoever they are. And usually we're talking about brain fog, chemo brain, you know, whatever people want to call it. It's not really from chemo. Cancer patients who get that really shocking diagnosis, or they go under anesthesia for surgery, or they have radiation, the red blood cells aren't bringing enough oxygen to the brain. There's many facets that go into chemo brain. That just happens to be the word for it. Probably should be called cancer brain. In fact, we have caregivers who say that they think they have chemo brain too, because they're just so stressed out. Well, the good news is there's a lot of things that go into this phenomenon of chemo brain, from not enough sleep to low blood cell counts, poor nutrition, dehydration, lack of sleep, and we can tweak each one of those things and bring your brain functioning, you know, back up. So that's actually a good thing, that there are multiple factors. Another thing that we say sometimes is we get stuck on bad things happen to me. And sometimes cancer patients are just waiting for that other shoe to drop, especially when it comes time for a scan to be done, or a new symptom, and it's a cough, and you know you've had lung cancer, and you kind of worry about that. When we expect bad things, we're more likely to think that things are bad and appraise them that way. But it could be that that cough actually made you go to the doctor, and he found that you needed an antibiotic, and it really wasn't cancer. And so that cough was a good thing because it helped you go to the doctor, to your primary care doctor, and get checked out. So rather than think about all the bad things, you have to start noticing the good things. And sometimes that takes a change in perspective with a counselor, or a gratitude journal, or just a diary, and being really aware of negative thoughts. And if you can practice mindfulness and be in the moment, your mind won't be racing to all the negative things that we catastrophize. Oh my gosh, you know, and make it bigger than it is. So the last thing I want to mention is that sometimes we have a thought that social workers are only for people who are poor or homeless or abused children. And I want to point out that there are social workers at all the cancer centers at University of Maryland who are oncology social workers who are trained with clinical skills to help you. And we all want to help you feel better and reduce your stress. And I wish you a very happy Survivors Day. Thank you for listening.